Welcome back to Meds Made Easy. My name is Tarun. Today we're going to be talking about Ursodiol. It is generally used for gallstones. The capsules specifically are used for gallstones, and then the tablets are used for biliary cirrhosis. I'm not going to talk too much about that one just because the mechanism is unknown, so it's kind of hard to tell you guys about it. But with the gallstones, that's a more clear-cut definition and mechanism of action, how it works, and that's what predominantly you're using this medication for. That's, I think 80+% of people out there are using Ursodiol for gallstones rather than biliary cirrhosis. So I'm going to talk about that. So to understand the gallstones, you have to understand what are they to begin with. So they're hardened deposits of bile. Now, bile is excreted, it's made by your liver, stored in your gallbladder, and it's released anytime you eat like a really high fatty meal or a meal in general which has some fat in it, and this helps kind of digest that fat and so that your body can absorb it. Over time, because there's too much cholesterol in your bile or bilirubin, it can harden up and cause stones. Now, most of the time your body kind of gets rid of this stuff without you even knowing about it, but from time to time it will cause like obstructions, blockages, can start causing pain, and then you got to take something for it, and this is what you take. It works by really breaking down the cholesterol that's in the bile, in the bile salts that are built up, so the gallstones. So it breaks up the gallstones that way, and it also prevents reabsorption of the cholesterol back into the body. So by doing that, it's kind of pushing the gallstones out and then also dissolving them on their way out. So that's the best way to describe how it really works. And so one of the big things is you don't want to take antacids with this. Tums being a big one. So if you have to take Tums for any reason, take it 1 hour before your Ursodiol or take it 2 hours after your Ursodiol. Don't take it in the middle of it. It interferes with the medication and it won't be able to do what it's supposed to do. For women that are pregnant, this is safe to take. For women that are lactating, you use with caution, so review this with your doctor before you proceed. And here's a list of side effects here. Things you want to watch out for are things like headache, dizziness, pain. It puts you at an increased risk of a UTI, a urinary tract infection. Otherwise, you're only for just a short amount of time, so you don't really see a lot of issues with it. It generally does what it needs to. If it doesn't, then we move on to other therapies on how to dissolve those gallstones, or we look into possibly just nicking the gallbladder out of there too, but that's surgical, so I'm not going to talk about that. But guys, any concerns, questions, comments, leave them down below. Hit subscribe, let us know how we're doing with the channel, and we will see you next time on Meds Made Easy.